Great. So if I could get you to start off, if you can introduce yourself and what you get up to.
Yeah, sure. I'm Jo. I'm a vet, and I founded a company called Petlearnia. We try to make safe information for pet parents, and the way that we do that is that we use vets to write e-learning courses. And the nice thing about an e-learning course, rather than just a website, is that by signing up to that course, we have your email address, so we can email you and say, or everything's changed, there's a new medication or anything like that. So we've really thought carefully about how to make sure that pet owners access good information now, but also making sure that they have access to that information in the future.
Definitely, that sounds amazing. I like the idea. It's like a course as well. So not only are they learning something, but I know majority of us humans, we like having that little satisfaction that we've got like a tick or a feeling of completion after learning something.
Yeah, definitely. And it's all self-paced. You can work through it and go, right, I don't really care about anatomy of the heart. I just want to find out what treatments my dog's on and why. But for some people, actually, they really do want to know, or it comes to spaying their dog and they want to actually see a video about what a spay is and how it's performed. So our content is very kind of broad and varied because most websites are just writing. You might get a little video embedded or some pictures embedded, but we're trying to like break it up a little bit. So there's like drag and drop tasks, fill in the blanks, just little things like that, just so you can sort of check that you understand properly. So we're just trying to really sort of revolutionize how people learn information about their pets and access that information and knowing that it comes from a safe place, which I think is probably the most important thing.
Definitely, that sounds amazing. How did you come up with the idea of it? Was this it's something that accumulated over the years? Like, this really should just be out there. Why isn't there something like this?
Yeah, pretty much. I mean, I certainly noticed that when I was in veterinary practice, when I was doing consults, that I would end up explaining the same things over and over again. But I also am quite aware that people are not necessarily in a good place to learn. They're often worried about their pet, or there's a dog barking or something. They're thinking about getting back to work, and they're not really able to sit down and learn there. So I was trying to think of ways I can make it easier for them. And obviously, the kind of classic old fashioned way of doing it is to give out a handout. And I tried to do that. But the problem with a handout is the printer's never working when you need it. The handout's out of date. It's just, and it's so they lose it, the dog eats it, whatever. Whereas the course is in your phone and you can go back to it a year later, 5 years later, whenever you need to remind yourself of the next steps. So it just kind of revolution or changes how we do upgrades that kind of client handout, and makes it more suitable for kind of modern life.
Wow, that sounds really awesome. I like the ideas. Obviously, it's transportable as well. It's not like they have to, even if you did more handouts, they'll take it with them and they can even obviously share it with people. Be like, look, I literally have this on my phone. It's amazing. So you can easily spread that, just all the information and be like, actually, this is a really great resource right here. And
Yeah, exactly.
it's
And
so
I think
easy.
especially when you've got several carers looking after the same pet, that handout's quite important because one of the things I found as a vet was that you people go home from their consultation and say the husband's brought the dog in. He goes home and his wife's like, "So what's wrong with the dog?" And that's where all hell breaks loose. In all honesty, and the amount of times I had phone calls from other pet members of the family going, "Can you just explain this again?" So not only have I explained it in the consult the first time, I've also explained it again on the phone. Um,
Mm.
while I don't necessarily begrudge people that time, because I absolutely don't, actually, they're not in a position to easily take it in. And I think everyone's time is better spent if they can go home and read about it in a safe way and not just picking up on some rubbish on Google, but that then they can come back in, they're informed and they're ready to ask the questions that they need to, rather than me trying to start from scratch and not knowing quite how much they know. So it kind of just enables the pet owner to kind of get up onto the same level as the vet, ask the questions that they actually need to advocate for their pets, because as
Mm.
pet owners, like, you are the experts in your pets. So I don't necessarily know which medication is going to suit your pet best. And it can really waste everyone's time and money if we try the wrong medication because you didn't fully understand what the options were. One of the things we're really trying to do is enable people to understand the options, and then kind of go into the vet and be like, right, well, this says that there's a liquid version, and actually tablets are never going to work for us, so I'd rather start with that. And it kind of just brings people up so they can have that discussion with their vets as equals, rather than kind of feeling on the back foot all the time in the consultation.
Now that sounds amazing as well. Like, it can just skip a lot of faffing, not in like, the worst way, but there's a lot less confusion. You can kind of get more to the point as well. And then, everyone else feels more secure in whatever's going on because they can, like I said, read up on it at home, which as an avid learner myself, that sounds amazing. So I'd rather be able to read up at home, and then when I come to the next appointment, I could be like, right, so this is what you were suggesting. I know what you're talking about now, at least. And then, obviously discussing
Yeah.
the treatment for the pet at the end of the day and making sure I think everyone's happy.
Yeah, and I think that's the thing is long term, the way that we see this working really is that vets direct pet owners to the information, say you
Mhm.
need to go and look at this. So we're not kind of trying to undermine your vet's advice at all. We're very much complementing your vet's advice, and all of our writers are vets, and we have another vet, a peer review vet, check everything as well.
Mm.
So we're making sure that a vet would actually genuinely be happy to use this. And what I really like is when our peer review vets aren't from inside the company, we get kind of specialists in and things. And when they get back to me and they're like, this is actually awesome. Can we use this? And we're like, yeah, that's the whole point.
That sounds amazing. And the idea as well that obviously you're all supporting each other, bringing out the best knowledge possible. And I think people feel reassured as well if it is literally written by vets rather than, I mean, there might be some brilliant copywriters out there who can write really good stuff. But obviously, if they haven't got that background, the medical knowledge, it can make things
Yeah.
just feel not as secure as if you're like, this is straight from the source. Like, they've been trained, they've been in there for so many years as well. They've got that lived experience of working with pets as well. It's not just that, oh, I've learned this. It's along the way as well, I've seen this and everything else. And that sounds
Yeah,
really
definitely.
amazing.
Yeah, inside the courses we try to kind of provide obviously like the important information, like you say, that we're taught, but also kind of our experience. So I've been working on some drugs databases and like writing about different drugs that you might be prescribed. And the data sheet doesn't list this as a side effect, but it's like actually me and all the other vets think this is a side effect. So it's trying to make sure that that information's in there as well. And we distinguish between the two, but like just sort of saying, look, in our experience, actually this is slightly different, or the statistics say that 90% of pets will have this, but actually we feel it's more like 50 or whatever it is. So just trying to make sure that the information is actually from our experience as well. And that's where those specialists do come in really handy, because they do see so many more cases of those particular diseases. So they can kind of sense check that and go, nah, actually, yeah, we would agree. Like the statistics, they were last done in 1997 and they could do with an update.
That sounds amazing. So, moving on slightly, obviously, we were kind of chatting previously about obviously summer is coming up. You've got a lot of pollen floating about the air already. To be honest, I know my car is absolutely covered with it. And obviously, I think some people forget that obviously, like pets do have allergies and reactions to kind of like harsh spring turns or pollen or whatever, even just like if there's loads of a certain type of plant and stuff. So I guess my first question for you is like, how can you tell if maybe your pets are having kind of like hay fever or allergy problems to like the seasonal change?
Sure. Well, I mean, yeah, allergies are really, really common. So I think we say like 1 in 10 dogs has got an allergy,
Mm.
which is quite a lot. And actually, my own dog is unofficially diagnosed allergic because her symptoms are just too confusing. But the classic case I see as a vet is a dog coming in with an ear problem. Now, adult
Mm.
dogs don't really get ear mites, and it's pretty rare for an adult dog to get an ear infection. Sometimes you get these dogs that do a lot of swimming, but other than that, they're kind of an ear infection is the first warning sign for me as a vet, that an allergy is quite likely. And actually, one study looked back at dogs that had known diagnosed with allergies, and 90% of them had a history of ear infections. So that's like the absolute like classic. And if an adult dog has more than 2 ear infections, I'm going, meep, meep, meep. We need to go in. We need to have a look at this dog.
Mm.
The other one that we find really, and it kind of goes together with this, is chewing and licking the feet. So if I
Mm.
have a dog that comes in with an ear infection, the first thing I do is look at its feet. And if it's got white fur there, they often go a little bit pink from all the licking. And it's really obvious. And I say, oh, looks like he's been licking his feet as well. And the owners will almost certainly go, oh yeah, always this time of year he starts licking his feet, or yeah, he always licks his feet. It's only the front two, it's only the back two, it's all four, whatever it is. It's again, statistically, it's about 85 to 100% of atopic dogs have a history of licking and chewing at their feet. So some people say, oh yeah, he bites his nails. I'm like, no, dogs don't really do that. He probably is actually just itchy. Um, Other classic symptoms, so changes in skin color, hair loss, sore eyes and sneezing, are less common.
Mm.
So, like our hay fever symptoms are less common. Sneezing is about 20%. So, not as common, but definitely something to keep an eye out for. Itchy bottoms as well. So, recurrent anal
Mm.
gland problems is another one that we do sometimes see. And it's unclear whether the anal gland problems are actually causing it, or whether they're just, the classic anal gland problem is scooting their bums. And actually, is
Yeah.
their bum itchy, or do they actually have an anal gland problem? And especially if they're coming in with the current problems and they've got another symptom, definitely worth exploring whether allergies could be a cause. Some dogs also have, so that's environmental allergies. Some dogs have food allergies as well, combined with environmental allergies, and some will just have food allergies.
Yeah.
Food allergy dogs tend to have like a chronic mild diarrhea, maybe rumbling tummy a little bit more often, something like that. But only about 1 in 10 allergic dogs has a food allergy. So it's not that common. And a lot of people kind of jump to, oh, my dog's itchy, it must be X in their food. And they get overexcited about a food allergy. But it's actually really relatively uncommon. And certainly the chance of randomly guessing what ingredient it is pretty much nil.
Definitely, and it sounds quite interesting as well, is that we need to remember that the symptoms you're talking about, it won't necessarily be like how humans present as well. And they're like, oh, licking the feet a lot. They don't think about it, but like it's like, yeah, they're probably, the pads themselves are quite itchy, but people don't tend to think about that because they think it's sometimes quite a normal dog behavior. So it's also trying
Yeah,
to guess when
definitely.
it's not normal and actually, okay, you're licking them quite a lot, there's a problem, and just going like, oh, they're obviously just, giving themselves a bit of a, I don't know, a bit of a grooming, because some dogs also like doing that. Because obviously you've got the behaviors of just like, maybe they do that because it's just a habit that they have, and obviously the biggest
Definitely. It
problem
can
of
be
all is obviously we
anxiety.
can't talk to them. So it's really just trying to figure out, isn't it, the behaviors? Is it normal? Is it abnormal? And figuring out from there is like, okay, well, what could it lead to? And everything
Yeah,
else. I think
definitely.
it's
I mean,
really good.
I would say that if a dog is just licking their feet and they have no other symptoms, how like, yes, you could take them into the vets, yes, you could investigate an allergy, but it comes to the thing where how are you going to treat that allergy if you find it? Well, you're going to give them drugs that have side effects. So you've always got to do a benefit risk analysis here. And if their only
Mm,
symptom is mild, so mild foot licking that you're not convinced they even have an allergy, it's probably not something that you're going to rush down. And that's what I'm saying with my dog, is that she will randomly be itchy in like
mm,
February, and then the next year it'll be June, and there's like no thing to it, but it passes quite quickly. And I'm kind of we started investigating it, and I was like, you know what, I'm not going to be putting her on drugs all year round just in case she's itchy at some point. We'll just,
mm,
if it becomes more regular, if it becomes more of a problem for her. And that's something that you do have to consider, is how stressful is it to be feeling itchy all the time? And if your dog is repetitively licking, if you are noticing an increase, then yeah, absolutely go get it checked out.
mm.
But if it's so mild you're not even sure, then I wouldn't be rushing to investigate an allergy. It's quite a long drawn out process.
Yeah, it definitely can be. So obviously moving on then, what do you recommend? Obviously, the biggest kind of step would be, I guess, if there really is an issue, obviously you would take them to the vet to investigate. But what can you recommend, any steps that pet parents could take where, maybe just to help avoid the allergy or just reduce, I guess, the suffering slightly. So, if they do get kind of itchy feet, but it's not too bad,
Yeah.
what can they do to, you know, give them the most comfort possible without taking that next big step, which is obviously investigating.
Yeah, definitely. I mean, going to the vets and investigating if there's any chance that they are in discomfort with the itching is sensible, because these things do get worse over time. So the earlier
Mm.
you can kind of start looking into it, it's definitely something that's worth doing. And like I said, it's also quite a long drawn out process. So what you don't want to do is not start and then a year later be like, oh God, now we've got to start. Um, the first thing I would say not to do is to change their diet in a panic, because like we said, not very many dogs are food allergic. And one thing that's really worth noting is that the first thing your vet's going to do in diagnosing these, once they've ruled out fleas, because a lot of aged dogs do just have fleas, once they've done that and checked there's no mites, no fleas, there's nothing else obvious, they can't diagnose an environmental allergy until they've ruled out a food allergy. And they have the only way to rule out a food allergy is all these fancy tests people will try and push on you, but they're not very good. They're not reliable, and scientific testing has shown that. That what they're going to do is they're going to do a diet trial, and the problem is finding a novel diet protein for your dog to have. If you see an allergy and you go and change their diet and then do it again and do it again because they're still itching, that's 4 fewer proteins that your dog can have, which makes it more and more difficult to find one, and potentially more and more expensive because they end up in a very complicated diet. So it is definitely worth kind of just putting the brakes on diet change until you've spoken to your vet for sure. In terms of other things you can do at home, like I said, this isn't instead of a vet visit, but definitely as well as. And going back to Petlearnia, one of the things we really focus on is the stuff that your vet definitely doesn't have time to tell you. And these home management things are definitely some of those. So if I had, hour-long consultations, which veterinary dermatologists have, then we would go into a lot more detail about this. But most veterinary consultations in the UK are like 10, 15 minutes. We just don't have time. So there are a few things you can do. So try to basically reduce the number of pollen or allergens that land on your pet. So you might be able to change where you walk, but I wouldn't stop taking your dog to the park just in case they're allergic to the grass. But you might say, okay, well, let's bathe them after a walk, or at least wash their feet down. That can help massively. Regular bathing, definitely, but you do have to be careful not to dry out the skin too much, because the skin barrier is really important to keep those allergens out. And if you keep desiccating the skin by constantly using harsh shampoos, then you are going to damage the skin barrier. So using quite a conditioning shampoo, but sort of semi-regularly, can definitely help as well. Dusting, vacuuming, even using an air purifier. I had a case that was on regular allergen vaccines, so immunotherapy, and then they had a reaction to that, and we decided to stop that, and they got an air purifier at home, and actually the dog was managed just with this air purifier, which would
Wow.
have paid for itself very quickly, actually. Um, so yeah, that was definitely worth a try. Ear management, so if they are those that are having regular ear flare-ups, then your vet can recommend an ear cleaner that can just try and kind of keep them under control a little bit. And it won't be, when you've got an ear problem, we'll often prescribe antibiotics drops, and then we see these patients come in, they're like, oh yeah, I've been applying the drops, once a week for the next 8 months. Oh my God, those antibiotics, don't do that. It'll be an actual in the ear cleaner. So it might be antiseptic, but it won't be antibiotic. So
Mm.
antiseptic ear cleaning. Around the house as well, reducing the amount of chemical cleaners is sometimes a thing. There was a massive sort of fad of using those Vax shake things on the carpet, and we had a
Mm.
lot of allergic dogs with really red bellies just from lying on the carpet where these
Oh,
Vax things had been
bless.
used. So it is just sort of thinking a little bit about what you're using around the home, maybe looking for steam cleaners rather than chemical cleaners and that sort of thing. So there are lots and lots of kind of minor things, but they should definitely be used alongside medical therapy, especially if your dog's uncomfortable. Immunotherapy, which basically involves injecting very small amounts of the allergens into your pets, they learn to cope with them. And that can be really effective in about 2/3 of dogs. Can reduce or completely stop the need for medications. And the other thing is, just to go back over diet, if they are food allergic, if your vet does diagnose them with food allergic, then allergen management from food is going to be incredibly important. But there are other things you can do with the diet as well. So we talked about skin barrier. Adding in omega-3s to their diet is definitely very well proven to help. And there's also some evidence that probiotic support can help with skin allergies as well. So those are two little things that you can look at adding. By all means, chat to your vet about them. They'll probably agree with me. But they're things that kind of vets don't often remember to mention because we're going, okay, let's go drugs, immunotherapy. What have we got time to talk about? And those sort of little things we can do at home often kind of get left out of the conversation.
No, definitely. It's like there's some really great steps. And I think as well, like, even if people are thinking about it, those steps obviously also help with humans and our reactions to things as well. So not only is it beneficial to your pets, it's also beneficial to you. So it's like, a win-win, even if they have to think, oh, I've got to do all this. And it's like, actually, you never know, you might find that actually you breathe a bit better when you're in your home if you have like an air purifier or even just more regular dusting. I think people forget that um, although, dust is never ending, like having dusting around is actually makes a huge difference to the environment.
Yeah, definitely. And I think it's definitely worth kind of remembering that, like you say, not only is it going to help your dog, it's going to help you, but we also have this thing called the itch threshold. So although they all seem like incredibly minor things, a dog with allergies doesn't take very much to tip them over the edge into itching. But if you can just take all these tiny little steps, those can add up
Mm.
to enough that they're not itchy. So sometimes it feels like, oh well, I'm not going to bother. Like that doesn't seem like it's going to work. It seems like a bit more hassle. I'd rather just give them the drugs. Actually, they kind of all add up. And I always
Mm.
used to say that medical doctors would be absolutely appalled at our handing out steroids like they're sweeties for these allergic dogs when eczema is a very similar disease, and they're all about the emollient creams. They're all about the kind of improving the skin from the inside out with adding in supplements and things like that. So they would be absolutely appalled at us just throwing steroids at everything. We are getting better as vets at trying not to do that, but it is definitely kind of one of those things that there are still improvements to be made in how we treat these dogs holistically and look at everything we can do to try and reduce that. Some people even put, I talk about washing the feet, but some people even put like little paw covers over their dog's feet
Mm.
for walks,
Yeah, like
just
little
so those allergens
shoes.
actually never come in contact, which is quite cute.
I think that's really good. And as well, you never know, it can be protecting the paws anyway. So you never know, there's always like hidden glass or there's some sort of stuff where obviously people are negligent and just chuck their rubbish everywhere. So you never know, those can be useful in the long run for so many
Yeah,
different things anyway. Like,
absolutely. And if your dog's going to tolerate them, and it's not a problem putting them on, then like why not? The
mm,
only thing I would say is just watch out if you do have a dog that's prone to chewing and swallowing things, that they're not left unattended with paw covers on, because I have had to do surgery to remove one, so just be
oh,
careful on
crikey.
that.
They pretty much kind of told them now how much they thought about their shoe covers then by eating it.
Yeah, pretty much. Yeah, it was actually for a wound, so it wasn't in quite the same situation, but they'd used it instead of a bandage over a small wound, and dog had just eaten it.
Wow. So is there anything else you'd like to add before you wrap up the episode today?
Um, no, I don't think so in terms of allergies. I mean, we've got an allergy course. It's in its finishing stages now. So that will be going live soon. And it will be great to get people on there, get people using it. A lot of these tips that I've given today will be on there, as well as anything else that any of my researchers could find that there's scientific evidence for. We also have an option on those courses for people to feed in what helped for them, because I really want it to be kind of a community thing as well. But unlike sort of Facebook or forums, vets are going to have eyes on, so you can feed that information on. But if it sounds like it's going to do more harm than good, then we won't publish it. So when you see those tips on the courses, you can be kind of confident that a vet's okayed that those
Mm.
go on there. So it's just worth, yeah, keeping an eye out for that course going live, maybe following us on Facebook, so that you can, or Instagram if you're on Instagram, so that you can see when it goes live. And we normally do, for the sort of first week after a course launch, we normally do like a little coupon code to get it for free. So yeah, please do keep an eye out for that if you have allergic dogs.
That's brilliant. Well, thank you so much for your time today.
Oh, thank you, Dawn. It's so great to speak to you.